Hello, and welcome to another episode of In Just 1 Minute or So. Today we're going to talk about what is an anxiety-related disorder. Let's jump in. Anxiety is a normal feeling that everybody experiences at some time. Anxiety is a natural response that is useful in helping us avoid dangerous situations and motivating us to solve everyday problems. Anxiety can occur in a variety of circumstances, from everyday problems, stress at work or home, to feeling that a person's life is in danger. Some life situations that could cause anxiety are divorce, death, loss of health, or accidents. This situation does not have to be negative to cause anxiety. Events like marriage, birth, or graduation can create a level of anxiety in people. Now, anxiety varies in severity and can range from a mild uneasiness to a panic attack. It can last for a few moments, days, months, or even a lifetime. People with anxiety-related disorders have excess levels of anxiety that significantly interfere with their day-to-day living. With normal anxiety, a person may feel anxious just for a limited time and then go back to a normal physical, emotional, and behavioral state. Those feelings are appropriate and normal for the situation. It is important to recognize that what might be considered a normal anxiety reaction can be different depending on family context, cultural beliefs, and expectations. These all need to be considered when trying to decide if anxiety is normal or a disorder. An anxiety-related disorder differs from normal anxiety in the following ways. First, it is more severe or intense. It is long-lasting. It interferes with a person's ability to function at work, within relationships, in the emotional state. And it occurs when a person is not in a state of danger. Excessive anxiety can result in the fight or flight reaction. The fighter part is ready for battle and cannot relax, and the flight part flees to avoid the situation. An anxiety-related disorder affects the way the person feels, thinks, and behaves. And if it's not treated, it could become chronic and lead to considerable suffering and disability, depression, substance use, and other problems. Anxiety-related disorders are one of the most common mental health problems, not just in Canada, but in many other places, affecting here in Canada as many as 1 in 10 Canadians. However, not all will seek the professional help. A high level of anxiety over a long period will often lead to depression. Many people have a mixture of anxiety and depression symptoms as a result. The Colbert Anxiety Scale is an international known scale for screening anxiety. The scale contains key questions and might help a person recognize that they or someone else may be having symptoms of anxiety. This is just a screening tool and is not intended to diagnose anxiety. If a person rates high on this scale, a professional assessment can accurately diagnose whether or not the person has a clinical anxiety. So the scale goes like this. You score 1 point for each yes if a symptom occurs most of the time over the past 2 to 4 weeks. Have you felt keyed up on the edge? Have you been worrying a lot? Have you been irritable? Have you had difficulty relaxing? If there are 2 or more that are yes, then you go on with these questions. Have you been sleeping poorly? Have you had headaches or neck aches? Have you had any of the following? Trembling, tingling, dizzy spells, sweating, urinary frequency, diarrhea. Have you been worried about your health? Have you had difficulty falling asleep? People with anxiety scores of 5 have a 50% chance of having mental health problem. With higher scores, the probability rises sharply. And that's all for today. Thank you so much for watching and see you in the next episode.